The cardiology department here is constantly innovating.
This began with C. Walt Lillehei, who's considered the father of open heart surgery, when he and his colleagues did the very first open heart surgery at the University of Minnesota in 1952.
Some of the first bypass surgeries and pacemakers were done here, so you can kind of feel within the walls that you're in a place that's great and where innovation has always been key.
We are always on the constant search for new knowledge, new skill set, and ideas to get our patients better.
We perform close to about 2,000 heart surgeries a year. That number is something we're very proud of, is among the largest in the Midwest.
Our ultimate goal is to promote greater cardiovascular health and reduce suffering from cardiovascular disease.
Together, we are changing how heart care is delivered to our patients. And we begin with preventive health care all the way to the most advanced end-stage heart failure treatment to transplantation. And it really takes a team.
The teams that we work with are the cornerstone and the foundation of what we do. We encourage each other. There is true mentorship.
Being in a system like mHealth Fairview allows us to leverage the academic strengths and rich history of quaternary level care at the University of Minnesota, the beneficiaries of this relationship being the patients and their families. Our team of cardiologists and surgeons have a collaborative relationship that ensures that the patient is at the center of decision making.
This entire team not only is providing excellent patient care, but we are also leading clinical trials in the space of advanced heart failure, which is offering life-saving therapies such as left ventricular assist device and heart transplantation. We are part of that cutting edge.
Our ECMO programs is one of a kind in the country, treating the patients with out-of-hospital cardiac arrest.
We started a program a couple of years ago along with our colleagues in the pulmonary hypertension group to treat patients who have chronic clots in the arteries in the lung.
Our team went to Europe, went to Paris, went to Vienna to learn these procedures and came back and started doing this at our center. And we have done several of these procedures with good outcome. Our patients are either going home on the same day or the following morning, and most of them are back to their normal life in 5 to 7 days.
We are very excited to share the news about 5 state-of-the-art cath labs opening at St. John's. These labs are staffed by physicians and teams with decades of experience and allow us to offer cutting-edge therapies for the full spectrum of heart disease right here in the community.
We're involved in databases that help make us understand our patient care better. And so we're taking the data and the knowledge that we're learning and we're sharing it with the world.
We have a wonderful research partnership with the Lillehei Heart Institute.
The clinical research that's done at the LHI covers the whole spectrum of the cardiovascular field, not only at the individual patient level, but also on a population and community level.
There was a patient that Dr. Schaefer operated on who had a very complex situation involving an artificial heart pump. In partnership with the Visible Heart Lab, we were able to print a 3D model of that patient's heart.
These models are very important to better understand complex anatomies or abnormalities.
That showed us exactly what we needed to do to remove this old pump and put the new pump in. That helped us to plan the surgery, and the patient had a very successful outcome.
The Visible Heart Laboratory is a series of laboratories where we do translational systems physiology. This year we're celebrating our 25th year of collaborating with Medtronic for doing a lot of their preclinical research, medical device testing on a routine basis.
I think we've created something very special here. They're bringing together of academic medicine and community medicine. It's been a very good integration that I think has benefited both sides.
What I love most about being at the university and being associated with the researchers and innovation of the university is I know I'm bringing the best healthcare in the world to my patient.
Every little thing that we can do, every little contribution that you can make is going to go a long way in our fight against cardiovascular disease.
We can only do this with the support of others who continue to allow us the opportunity to look at new ideas, new research.
We're confident that with continued support together, we can scale greater heights and make even stronger impact in our fight against cardiovascular disease.
Seeing the outcomes of patients when they do well brings about a joy that nothing else can replicate.